Hello everyone. I would like to give some information about COVID-19 that has been provided by WHO on behalf of Sinopec.
Confused or worried about symptoms during the COVID-19 pandemic? If you only have a runny nose or are sneezing, you may have a cold or allergies. Have you lost your sense of taste or smell? Are you experiencing shortness of breath? These are common symptoms of COVID-19. Coughing, fatigue and fever are all symptoms of both flu and COVID-19. If you have a temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit, call your local healthcare provider or hotline for medical advice and ask whether you need a COVID-19 test. If you have any COVID-19 symptoms or are waiting for test results, stay home and isolate from other members of your household. Drink fluids and eat well. Always wear a mask if you're in the same room as others. If you test positive for COVID-19, follow your healthcare provider's advice. If at any time you experience a danger sign like difficulty breathing, chest pain, confusion, loss of speech or mobility, don't wait. Seek medical care immediately. Remember, you can prevent colds, flu and COVID-19 by following a few basic precautions. Stay safe and protect each other. We're in this together. Know your risk, lower your risk.
Hello. Today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water absorbent, and the mid layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
Hello and welcome to Science in 5. I'm Vismita Gupta Smith. We are talking today about the Delta variant and vaccines. Dr. Soumya Swaminathan, WHO's chief scientist, is our expert today. Welcome, Soumya. Our first question to you, Soumya, is we know that the Delta variant is more transmissible. Please explain to us what kind of protection we get from the current batch of approved vaccines.
So we're talking here about the Delta variant, which is the fourth variant of concern described by WHO because it's both more transmissible than the previous variants and also has been able to resist the antibodies that we have in our blood. So what that means is that you need a higher level of antibodies to overcome this variant as compared to, let's say, the alpha variant. Now the good news is that all of the WHO emergency use listed vaccines do protect against developing severe disease, hospitalization and death due to the Delta variant. So there are studies now from countries where there is a predominance of Delta variant to show that people who've been vaccinated are much less likely to end up in hospital. And you need the full course of vaccination in order to give you that full immunity to protect you against the Delta variant. So the important thing is, if you have access to a vaccine that's approved by WHO, please do take it and take the full course so that you can be protected both against the Delta and other variants of COVID.
Soumya, explain to us, please, the level of protection that you have if you have received one dose of the vaccine versus if you're fully vaccinated.
So the main goal of these vaccines is really to prevent severe disease, because what we want is for people, even if they get the infection, is for them to recover from it and not become seriously ill. So that's something that all of these vaccines do really well. Of course, there are different levels. You read about the efficacy trials. They may range from 70 to 90%. But in terms of just looking at the prevention of severe disease and hospitalization, they're all very good, over 90% effective. Again, they vary in the protection against getting infection. Ideally, you'd like a vaccine which completely prevents you from getting infected, therefore you can't get ill. But none of the vaccines that we have currently are 100% protective. So this is why even if you're vaccinated, you can get the infection, but the chances are you'll get a very mild symptoms or no symptoms at all, and that your chances of getting seriously ill are really, really low.
So Soumya, if we can still get infected and also infect others, even after we are fully vaccinated, then why get vaccinated?
There are two very good reasons to get vaccinated. The first is to protect yourself from getting severely ill if you catch the infection. We know that there's a certain proportion of people of all age groups who do get severely ill, and you could have a chance of dying from this disease, and this is what we want to protect. So that's why you want to get vaccinated in the first place. But secondly, if you get vaccinated, and yes, you may still get the infection, because we know that these vaccines are not going to protect you 100% from the infection. So there is a small risk you get infected and you could pass it on to others. Why do you want to take the risk of doing that? Why do you want to be one person in the chain of transmission? What we need to do in the world today is to break those chains of transmission, get a control on this disease. So that's why we say get vaccinated as soon as you can get access to your vaccine when your turn comes, and continue to take all the precautions so that you are completely protecting yourself as well as protecting others around you.
Thank you, Soumya. That was Science in 5 today. Until next time then, stay safe, stay healthy, and stick with science.